Lovely. Um, I'm absolutely delighted to be with you this evening on behalf of the European Fertility Society and my IVF Answers, who have created a wonderful bank of events for you as a means of support and education for all who are on a fertility journey in some way. I am Barbara Scott. I'm chair of the Association of Reproductive Reflexologists, and I'm absolutely delighted to introduce to you this evening Dr. Beatrice, who is here from Vida Fertility Institute. She is a gynecologist who specializes in implantation failures, ovarian insufficiency, and working with endometriosis, adenomyosis, and fibroids. And she's going to be speaking for us this evening on what you can expect on your IVF journey when using donor eggs. So before I hand over to Dr. Beatrice, just a few little housekeeping things for you. So the first thing to say is this is recorded, but everything that you may want to post in the chat box is completely anonymous. So no one will be able to identify who you are. At the end of the session, after we have listened to the presentation, I will read out your questions if they are long. I may share them on the display, but that will also be anonymous. So please do freely ask your questions. You can do that safely and with anonymity. So I just wanted to make sure that you feel safe about doing that. I will keep an eye on the little chat box, and as I say, we will come to questions at the end of the session. So without any further delay, I am going to hand over to Dr. Beatrice, and we will get the presentation up for you, and I will leave you in her very capable hands. So thank you so much for being with us this evening.
Thank you, Barbara. Thank you so much. Well, hello, everyone. I'm Dr. Beatriz Valderrama, like Barbara said. And I'm a subspecialized in reproductive medicine, made my career in gynecology. And I'm very happy to help you today with any kind of question you have. Thank you for attending my webinar. Me, myself, I'm working in Vida Fertility since a year ago. It's a clinic which exists already for 2 years, more or less. And it is specialized in foreign patients. So that's the reason why I started working here, apart from others, because I studied my career in English and then made my specialty in Germany. And I really much liked to work with international patients, and that was one of the reasons. On the other side, I built myself in IVI clinic, and that was wonderful. But this clinic is a little bit tinier, and it's more like one-to-one treatment, and I can individualize more the treatments the way I want. So from my personal experience, I think you would feel a close contact with us. And okay, and I want to tell you today, Barbara, where would I find my presentation?
I'm just going to share the presentation for you.
Perfect. Awesome.
There we are.
So there we go. So yeah, we have clinics in Madrid and Alicante. Me personally, I'm working in Madrid, but you can guys always decide in which clinic you want to do your treatment, and then you would be assigned to a doctor. Okay. Okay. So like every reproductive treatment, every clinic of reproductive medicine, we cover all kinds of reproductive treatment, from fertility preservation to insemination up to in vitro fertilization, either with your own eggs or with donated eggs, or the same way with sperm, either with own sperm or donated sperm. And as well as regenerative medicine, in case where we have an atrophic endometrium or a uterus which has gone through a lot of operation and has difficulties building a proper endometrium, a regenerative treatment with PRP can help, as well as with when in case of more aged women who have a low ovarian reserve, we can try to make an ovarian regeneration. But today we are going to center ourselves in egg donation. That is actually together with the embryonal biopsy in day 5, 2 of the treatments for which most of the patients come from abroad. Either because there is a long list of patients and they cannot achieve the treatment as soon as they would like to, or because it's not permitted in their countries. And well, as we all know, to realize a treatment with the eggs of another woman is not at all an easy decision. I can understand. There are patients who say, look, until I will always try with my eggs, and if not, I'm happy to keep living my life another way, and it's also beautiful, perfect. But nowadays, because we all start later because of our careers, or we find a person in another moment, and it may not be possible anymore to use eggs, a lot of women decide to do it. But there is a lot of uncertainty, and that is with which I would like to help you today. How is the legislation here in Spain? How do we select our donors? How does the whole trip take place, from the beginning to the end? Something which I would like you to get familiar with, and which helps a lot my patients in when they are doubting if using the eggs from another woman, and which has been studied in the last years more and more, is the epigenetic. The epigenetic, for those who are not familiar with the term, is how the environmental factors affect in our genetic. It has been shown that in the fluid of the uterus, there are some molecules produced which allow a fetus to mother interaction, at a genetic level in the uterus. By these molecules, the mom, the carrier, can inactivate or activate some genes in the fetus, which summarized easily for you to understand, maybe imagine that we have one blastocyst. This is the embryo, how we call embryos in day 5, which is the state where we want to transfer the embryo. We have one blastocyst, and we transfer this same blastocyst to 2 different women, the same one. This is going to be completely 2 different kids, which shows that for sure there is going to be genetic also of the mother, although she does not use her egg. Okay, and I think this is something very, very, very useful. Okay, for which women would profit from egg donation? Most of them are women with an advanced age, with low ovarian reserve or premature ovarian failure. Women may profit from it who had a lot of unsuccessful IVF with their own eggs or repeated miscarriages, or in women who there are some genetic alterations. How does the egg donation legally? How is the egg donation legally in Spain? Well, it is anonymous, which means either the donor may experience who her eggs are going to be for, or you may not experience who is the donor. Okay. The only things you are allowed to know about your donor is what is her age, and what is her blood group, okay? Because the law says that of course, it has to be a compatible genetic blood group, okay? And this is the reason why this information you need to have, okay? The other parameter which decides who is going to be your donor, is the physical characteristics, okay? The donor which is assigned to you must look as similar as possible physically to you, okay? Egg donation in Spain is a treatment which already has been practiced over 30 years, okay? So we definitely have experience with it, and it has most of the times a good success, okay? Because in the term of egg donation, we then don't care anymore about the ovarian reserve or the age of the woman, but her uterus, okay? And the success rates of implantation and of pregnancy are between the 50 and 70%. How does it work here in Vida Fertility? Well, in the first place, if you would like to get some information, we will do an initial medical consultation. There you can tell me your story and I will get some data about your medical history. You can tell me what are your wishes, and I will try to get in detail your story to individualize the treatment as much as possible. Okay, I will check in this first consultation also if you already made any exam, any of the tests which are required, and then I will let you know which test would be missing. We have certain tests which need to be done in order to see that you are healthy, and which help us also to individualize the treatment. Okay, as soon as we have all these tests ready, then we can start with the treatment, and we can start selecting a donor which is appropriate to you. Okay. What would be the next step then? Your partner or also a sperm donor would need to come here and leave a sperm sample, which we will use the day of the egg retrieval of the donor to fertilize the eggs. Okay. How does this process take place in the donor? Well, like in an IVF treatment, what we have to do is the first day of the period of the donor, we will make an echography, an ultrasound, in order to see that she's at the resting state to start the stimulation. If everything is fine, we start the stimulation. What does it mean? A stimulation is giving some injections, follicular stimulating hormone, which induces the growth of the eggs, of the oocytes within the follicles. We need 12 days approximately for that. 12 days of injections of this FSH or LH, okay? You have to put one injection. It is a tiny needle, around 2 millimeters more or less, which you have to put on your tummy once daily. And the donor has to put in her tummy once daily. And I will do serial ecographies since the moment she starts putting her injections. It means every 5 days approximately, I will make an ultrasound in order to see if her follicles are growing properly. When it is ready, after 12 days approximately, I will do the egg retrieval. Okay? And the day the eggs are retrieved, we will fertilize them. This means we will inject the sperm of the man. Okay. The next day, we can already see how many of them fertilized, so that the genetic of both came together. And those embryos in day 1, zygote is called, will be put into an incubator where the embryonal development happens. Okay. We let them into an incubator until day 5. Where we want them to, the moment where we want to transfer in a blastocyst stage in day 5, okay? Then when they reach this state, we can either transfer them directly, this would be a fresh embryo transfer, and freeze the rest. Or if you don't have the availability or it's not the best moment, we can freeze them all and prepare your endometrium, which is the lining of the uterus, which needs to be of a certain thickness, in order for the embryo to implant. Then we will do this endometrial preparation in another cycle, okay? The endometrial preparation, in order to make the endometrium thick, we need to give you some estrogen pills, along 10 to 12 days to make it reach the certain thickness, okay? Then I will make an ecography, an ultrasound, and if the endometrium is then thick enough, we can add progesterone to this estrogen for 5 days, and after that takes the transference place, okay, of one or maximum a dual embryo transfer, okay? And we always recommend to transfer one embryo. If it would not be safe, I would not let you transfer two. But anyways, medically, we will always recommend you to transfer one. Why? Because if both of them implant, this is a twin pregnancy. It works perfectly. No? There are a lot of twin pregnancies, but this means already that it is a risk pregnancy, okay? Because it's two babies, it needs a closer monitoring, because this may mean that there are more risk of premature delivery, okay, since two babies take more place, high risk of gestational diabetes, of cervical insufficiency, or hypertension during the pregnancy, okay? Nevertheless, like I say, there are a lot of dual embryo transfer, okay, and it happens very good, and the pregnancy works very good, but you just need a closer surveillance, okay. How would this work with you? You can come with your partner or once to, so that he gives a sperm sample, so that we have it here for the moment of fertilization. And then you can use this same time if you want to make the first visit and do the missing test, or you can rather do this test at your place and send me the results. It's perfectly fine. But for sure, we would need a sperm sample, okay? And the next time would be that you would need to come would be the embryo transfer, okay? In the moment where the day where we would transfer the embryo. It would be enough that you're here the night before the transfer. The transfer would take place the next day. It is in, you don't need anesthesia or anything. It's at the consultation. It is like doing a pap smear. I just come through the vagina into the uterus under ultrasound control, where with the catheter, I will deposit the embryo in the middle third of the uterus, okay? If you decide that you want to do an embryo transfer, a fresh embryo transfer, which would mean that exactly when the embryo reaches day 5 in the incubator, we transfer it. If you want to do directly on that day, we need to synchronize your cycle with the cycle of the donor, so that you are both at the same point. And for that, we would give you both the pill to make you both at the resting state, and we would stop the pill at the same time. And 5 days after, we would start stimulating the donor, and we would start parallelly preparing your endometrium, okay? So these are the tests which you would need to do, which I'm not going to go over now. And in case you have interest, I can forward it to you. Okay, and now up to our donors. Who are our donors? Well, it depends on the clinic. In this one, we have our own donors. This means the women come to us, and we are the ones who do the selection process, and we are the ones who stimulate the donors, make the ultrasound controls, and the ones who make the egg retrieval. So the process from the beginning to the end, okay? 70% of these patients are usually students, and 70% of them are Spanish. The other 30, I would say, they are mostly from Latin America, okay? And they are all in a range age from 24, 25, okay? But the allowed age to donate is from 18 to 35-year-olds, okay? So what criteria do the donors need to meet so that they can be selected for to be donors? Well, like I said, this age range, and then they need to have, of course, a good ovarian reserve. This is what we are looking for, okay, so that we get the most eggs possible. And then they go through several examinations to see that they are physically healthy. They must go through a psychological test and approval through the psychologist, and then they will be tested to 300 genetic diseases. Okay, 300 genes, recessive genes, will be studied. Okay, there are 7 of them, 7 genes of these 300. If they have mutation in these 7, they will be directly discarded. Okay, if they may have a mutation, other mutations in the other genes, it's okay. We all have mutation. Having a mutation does not mean that the disease is going to express. Okay, they just have the mutation. But this is the reason why it is interesting, although for the donor is obligatory, that the partner also does this test, because they are recessive genes. Okay, this means that in order to give this disease to the descendants, yeah, to your heritage, both the man and the woman need to have the same disease. If this is the case, there is then a 25% chance of transmitting it to the descendants. Okay, if only one of the parents have this, it's not going to be given. Okay, the chances that both of the partners have the same genetic mutations is rare. It's extremely rare, but possible. So I highly recommend that this other test would be done in your partner or in the sperm donor. Okay. If all these criteria are fulfilled, then they can be selected. Okay. And then out of this pool of selected donors, we would assign the one which fits better to you. Okay, this is about the endometrial preparation, which I already explained you to follow up the scheme, okay? Which we can do it by synchronizing your cycles, once again, if in case we're gonna do a fresh embryo transfer, or we will prepare it just with the cycle you would like to. We always have to start with the first day of your period with the endometrial preparation. So you would just need to choose if you were gonna do a frozen embryo transfer. You choose the cycle with which you wanna start, and with that period, we start. Okay? And when the endometrium after 12 days already thick enough, and we add the progesterone 5 more days, after these 5 days, we will do the embryo transfer. Okay? To say also, which I did not mention, the chances of pregnancy with a single embryo transfer are around 50 to 70%. With a dual embryo transfer, the chances increase a little bit more, up to 80. Okay? So, and this would be basically all the basic information you would need to know. Now, I will be here and I'm open to all your questions. Barbara?
I am here back with you. That was so fascinating. Thank you so much. Thank you so much.
You're very welcome.
That was really fascinating and such important and information, you know, for all of the patients. That was laid out so clearly, I think, for everyone
Thank
to
you so much.
follow the process through. There are quite a few questions. I just one of the questions I wanted to ask, because you were talking about a range of tests that patients may have to undergo. I am guessing that what you have is partner clinics in their relevant country that would carry out tests for, you know, monitoring endometrial thickness, or is that how it works?
Look, in the first place, they need to do several tests, which are blood works, okay, and then they a pap smear, the serologies to say they don't have any sexual transmitted disease, and so on. These are basic tests in order to start. But once we start the treatment for the endometrial preparation, they need an ultrasound after 10 to 12 days, because after these 12 days, usually the endometrium should be already thick enough and prepared for the transfer. Yeah. If it is already thick enough, this day we could add already the progesterone. And 5 days later would be the transfer. This one ultrasound can be done in their country with no problem. Okay. They can go to their gynecologist, do this ultrasound, and then they forward to me the results. And
Okay.
then this same, the moment I see it, I will answer and tell, okay, so it's thick enough, or we need some more time. We add progesterone, transfer will be this day, or I will just give the indications according to the ultrasound that they make with their
Perfect.
gynecologist.
Yeah, perfect. That's lovely. I just thought that was a useful piece of information for everybody to have, but so fascinating. And I loved your explanation about the epigenetics, because
I
it's
know.
so fascinating
Mhm.
that that women can, even before implantation, they start to influence the genetic expression of that
Yeah.
little tiny. It's just fascinating, isn't it?
This is definitely something which me myself helped a lot in terms of egg donation, and this is
Mm,
something I always try to say, because it's so difficult to take this decision, no? And I think
yeah,
me personally, but also a lot of women to who I tell it, relieves a lot.
yeah,
You know,
yeah,
for sure, you're not just gonna carry it and deliver it, which is the, for me personally, the
yeah,
main work, and then you're educating the kid, but that it has your genetic as well. We don't know
yes.
which percentage, but I invite you to read some of these studies, because it's very, very interesting. It is a epigenetics in egg donation.
Yeah, yes. I mean, my understanding is that the greatest influence on genetic expression is those 9 months in utero.
It is.
So, I mean, actually being able to, aside from the fact that you are able to carry this baby and develop that relationship in utero, the fact that, you're going to have such an influence over how those genes are expressed. I think, for me as a practitioner, when I'm speaking to patients, I think it's very reassuring. So,
Yes.
yeah, yeah. But
I,
now I should ask lots of questions. There's lots of people, and I don't
um,
who have asked questions. So if it's okay, I'm going to read them out,
okay.
and we'll kind of go from there. Any of the longer ones, I'll display them on the screen. So the first person, May, has asked, "Do you have a Japanese egg donor?"
This is a very good question. We don't have Japanese egg donors. Sadly, this would be very nice, but they do not come and donate in Spain. So what we do have is Asian-like egg donors. Okay, so with the characteristics, physical characteristics similar, but not Asian donors.
Okay, that's lovely. Thank you very much. So important. These are really, there's some amazing questions. This one let me just, I may display because it's slightly longer. So I'm just going to pop it up on the screen. But I will read it out as well for those people who are just listening in rather than watching. So this is from Becky. She's saying, I've had 3 failed transfers with donor eggs. What questions should I be asking my clinics? What extra checks need to be done? I've already had a full MOT check and my uterus is of good health with no issues.
MOT stands for, Barbara?
Oh, I think what she's saying is she's probably had
I I
antral
understand.
follicle count scan, and yeah, MOT stands for oh no, my brain has
It's
gone
okay, but I
completely.
understand her I
Yeah, yeah,
understand the questions anyway.
yeah,
Okay, exactly.
yeah. Lovely, thank
So,
you.
well, after already 2 failed embryo transfers, we like to start already investigating new things. Okay, it does not only depend on the embryo factor. Okay, we say this is like up to 70%, but there are also other factors which take place into a pregnancy. And this is, as you said, the patient, very good, the uterus. Okay, so that we have a good endometrial development, no, that it thickens properly for it to implant. But there are a lot of cases where there may be an underlying chronic endometritis. This is an inflammation of the endometrium, of the mucosa of the uterus. And the thing is, most of the times, this chronic endometritis is asymptomatic. Yeah, and I think if it is an infection, the mucosa is inflamed, it is more difficult for it to stick. So what I recommend in these cases is to make an endometrial biopsy, This is easy. It's done also with a cannula. You don't need anesthesia. It's like a pap smear. We will take some cells of the uterus and analyze it. If it comes that you have a chronic endometritis, we can give an antibiotic therapy for 2 weeks and then repeat it. Okay. What else can we check? Also in the uterus, with this same sample, we can do another test, which is to check the microbiota. Okay. What is the ambient, the environment in this uterus that makes it proper for the embryo to implant? Okay, so I suggest, depends also, it's also an economical question, but once when I tell my patients to check for CD138, which is the parameter to see chronic endometritis, I suggest already to do the microbiota. And one third, which can be done with the same test, is the ERA, the endometrial receptivity assay. This measures the window of implantation. The window of implantation is the moment where the chances for the embryo to implant are the highest. Okay? By most of the women, it's the same, by 80% of the women after 120 hours of progesterone. But this window, there are in some women which it may be displaced. She may need less or more hours of progesterone before the transfer, yeah, for to have higher chances. Okay, this all can be done with the same biopsy to measure all of these three parameters. But if I had to choose one and to start, would be definitely to rule out the chronic endometritis. What other factors may affect when it is not the embryonal factor and it's not the uterus? Is the coagulation. Okay. The coagulation factors, okay, may make the blood thicker, and if you have any kind of abnormality in your coagulation and the blood is thicker, the blood carries oxygen, and the endometrium will be supplied with blood and with oxygen for the embryo to implant. If the blood is thicker, yeah, the transport of oxygen is more difficult, and the chances of implantation are also less. So I would definitely do a thrombophilia analysis. Okay, we start in a stepwise. I would do these two things. Okay, I always analyze this, and if I don't see any defect, then it's when I go further to the immunology. This will be the other last factor which may affect. Okay, there are several things which can be checked. The natural killer cells. Okay, they may be in a certain range. Now there are medications if they are increased, which we could give. We could also check the compatibility, the acceptance of the fetus by the mother, yeah, like with donor organs, by measuring a thing which is called KIR-HLA. Okay, by then we can check if you need a certain specific donor to be assigned to you, so that you accept the embryo better. Okay. So if I don't know if some of these tests would be done, but if not, have been done by you, but if not, I recommend you to do. And if you have a question about it, you can ask me. Okay.
That's very comprehensive. That is very comprehensive testing, because obviously those are not standard tests for women to undergo when they are having a donor cycle. So I'm guessing those are that's testing that you would undergo when things are not going according
exactly
to plan.
So
yeah,
I would recommend to, after one transfer, we usually, or it is not protocolized in the reproductive medicine protocols, to start investigating, but after the second, yeah. But a lot of women tell me, look, Bea, I would like to check something, no? So if they would already like to start with it, I suggest to do the thrombophilias and the CD138. It's usually very useful.
Yeah. And you have medicalized protocols to remedy those things. So I'm guessing things with the thrombophilia, maybe blood thinners of some kind.
Exactly. So if there is something altered in the coagulation, if it is altered to a point that it needs to be medically treated with heparin, and how long, if just during the transfer or also during the pregnancy, this depending on the abnormality, then it will be adapted to the woman.
Yeah. Could there be a male factor issue in terms of embryo quality that might be
exactly there? It can be also male quality, of course. So, for example, if these things happen, no, that after 3 transfers of a donor it didn't work, or if with the eggs of this donor there was a delivery by another patient or whatever, we try then to change the sperm, yeah, to see if the results are different with it. Okay. Usually, if we are talking about a spermiogram, a spermiogram is the analysis of the sperm in a man, where we see the concentration, the motility, and the morphology. If all of that is okay, and it is a man under 45 who does not smoke, who does not consume a lot of coffee, should actually be okay. But there is something which the spermiogram does not check. And a lot of times when it's done after, when the things don't work, and which I find very helpful, and it is to check the sperm quality, which is not done in the spermiogram, which to check the genetic of the sperm, okay, to check the fragmentation. Every man has fragmentation, okay, which are like breaks in the DNA chain, which codes our gene, yeah. And this is not normal, the fragmentation, but we all have certain fragmentation. No? In this case, males have fragmentation. But if this is increased above a certain level, okay, this may also affect, in the rates of fertilization, as well to conversion to blastocysts, so that there may be less amount of blastocysts, or then that there are less chances of implantation or higher risk of abortion. Yeah.
And I'm guessing that, I mean, my understanding, I may be wrong, but my understanding is that sperm donors' samples are not, they are tested, but they're not tested for sperm DNA fragmentation.
Exactly.
Donor sperm, yeah.
Exactly, donor sperm. Partner sperm, well, I see the situation if it is a man under 40, like I say, with everything is good on the first place. I always mention it because if you want to go for security, then I say, why not to do it, okay? But it wouldn't be in the first place medically indicated. But I always tell it, and the men or the couples tend to do it from the beginning on. But if not, and I see a situation like this patient, sadly, then it's the moment when, if we go for a new cycle, I definitely say we have to guarantee the male factor. No? And in the case where, in these cases where the fragmentation is increased or there is something more wrong, then I suggest to go with fresh sperm, because if it is a normal sperm, normal fragmentation, everything okay, there are not many differences in the success rates. While if we are talking about a sperm which is a little bit distorted, have a higher fragmentation, we have better chances with the fresh sperm. And the good news apart from that is that fragmentation can be corrected. Like we have a technique which is called technique of sperm selection. Here in Spain it's called fertile chip, but there are, or CIMOT, but there are different names, okay? By this technique, we can filtrate and select these sperm cells with less fragmentation. Okay, so we are assuring the male factor. Okay,
wonderful. Yeah, I'm familiar with Zymort, but yeah, so I understand the principles. But yes, that's fabulous. So I think, you know, the interesting thing about that is what you're doing is you're saying that we may identify these things, but there are solutions to them. There are a way of working with them, overcoming them.
Thank
which
God.
is yeah, absolutely. Yes.
I would like to have more solutions in terms of women, because male is, if you know, then we can do this or we can do. And in women, we can investigate a lot, but I wish we could correct more things directly, no?
Yeah, of course. Now we've got some more questions here coming in, so I'm going to we've got quite a few sitting here, so I'm going to kind of try and get through as many as I can. If we can't, then we send them all on afterwards. So I think if I've pronounced your name incorrectly, I'm so sorry, but I think this is Shona. So she is saying, if a menopausal woman can conceive, can a menopausal woman conceive using donor eggs, and can the same protocol be used to conceive using her postmenopausal eggs that might be dormant?
Postmenopausal eggs, her eggs.
Yeah.
With her eggs, it's not going to work because the thing is, if she's menopausal, first of all, she will probably have no more reserve. She will have no follicle. First of all, we would do an ultrasound to check that, okay? She may most probably not have follicles, no place where we can make eggs grow. And if she may have one residual or something like this, the most probable is that if we stimulate her, if we give injections in order to make it grow, she's not going to respond and it's not going to grow. Or if it grows, the follicle may be certainly empty. And if we get an egg, maybe very, very, very hard to get a blastocyst. So it is impossible, so to say. Okay. Something different would be if she's premenopausal. Already the chances are way lower because the genetic is very altered in the eggs and have still low chances, but we are talking about something else. Yeah. And the second part, the way to prepare them, yes, a postmenopausal woman can conceive with donor eggs, yeah, because as I say, we take the term age out and we are concerning about the uterus. What about the uterus in a menopausal woman? Well, we have seen like the endometrial development also turns difficult from 45 years old onward, but it works. It also works. What I tend to do in these women is to make a test cycle, a mock cycle to see. So before I'm going to do any kind of transfer, it is cheap because you just need to buy estrogen pills. The estrogen pills are cheap. And I see how it is growing. And if you need, for example, a little bit a higher dose of estrogen than another woman, in order to see for the real cycle how I need to prepare you. Okay, I usually do this with premenopausal women or irregular cycles. Okay, but this usually works. It's not a problem to at the end to get an endometrium, unless it is a woman, like I say, who had a lot of endometrial or uterus operations or a very atrophic endometrium. There we may have a little bit more difficulties, but without these characteristics, it is okay to prepare a uterus in a menopausal or postmenopausal woman, and she would be prepared same way as another woman, and she can conceive the same way.
Wonderful. And so doing the mock cycle, you're ensuring that you can see what any of the issues might be before doing, a real cycle, which is so sensible. That's wonderful. Thank you. Now we have one from Ima saying, 42 years, just had a fourth failed IVF, 3 miscarriages, PGTA testing, nothing. Is donor eggs the next option?
I would say so. If she, after so many failed IVFs, also by using PGTA, I don't know about if she got any euploid embryo or not, but the next step would be egg donation.
Yeah.
I mean, we could discuss her case more analyzed. She would like to tell me how it went with PGTA and if I see chances of trying it other way. But I think after so many tries and by the age, for sure, the most recommended from my side would be egg donation.
Yeah. It sounds as though it would be sensible for her to have a conversation with you about her individual circumstances in more detail so that you can provide individualized advice. Yeah, that's lovely. Thank you. I think you've already answered this one. So Tamta has asked whether all donors are Spanish, and I think what you've said is Spanish and Latin American, from what I remember.
Yeah.
So I think mainly Spanish. Did you say 70% Spanish and 30%?
70-80%. Yeah.
Yeah, lovely. Thank you.
But there are also, they say most of the Spanish donors, they have my characteristics, but there are also donors with clearer skin, clearer hair, clear eyes. Yeah, it depends on the moment which donors we have in this moment, but there are very, very a very varied range of donors.
Yeah,
they are Spanish.
Yeah. And the thing is, my guess is what you would be doing is actually having those discussions in terms of matching you know, skin color, hair color, eye color, all of
Exactly.
those
We
things.
always need photos from, although we see the donors from her and see to do a matching, like also interpupillary distance
Yeah,
and the color and the facial characteristics. We need this.
yeah,
And something I didn't say and is important is we usually need 1 up to 2 months to find the proper donor.
of course. Yeah, of course. Yes, yeah. But I think also from what you're saying is that would be the only thing that would take time. There is no waiting list. They can then,
No,
once you've
this is
found
the
a
good
donor,
thing.
begin
Yeah.
treatment.
You're right. That is the thing that if you decide to do the treatment, we can straight away go for it. There's no waiting list
Yeah,
because we have a lot of donors.
yeah,
But the point is to find the suitable for you. And
yeah,
this takes a little bit more time.
yeah. And very reassuring that you source your donors and assess them yourself. I think that's so important because
Yeah.
you will understand exactly who you have and who's going to be most appropriate. So,
Yeah,
yeah.
it's more reassuring also for ourselves
Mm,
than
mm,
working with the bank. I
of
mean, the
course.
rules are the rules and it will always be okay because it's the law.
Yeah,
But it is also, it gives me trust to see and know who will be assigned with who. We, of course,
yeah,
have our department who takes care of the donors specifically, but to be as the ones who assign them, this is really reassuring. Yeah.
yeah, yeah, absolutely. So Mark has asked, in Spain, is it allowed? I'm not quite sure what you're saying here, Mark. Is it allowed uh, for the egg donors' nationality? Is it allowed to? Yeah, I'm not quite sure what you're saying, Mark.
Is it
But
allowed for the egg donors nationality?
yes. So basically, are you asking? Please do make another comment, Mark, because I'm not quite sure what you're saying. But are you asking whether whether it is whether in Spain they're allowed to know the egg donor's nationality? I'm not quite sure what you're asking. Please do pop it another question in, and we'll come back to it.
Yeah, that's better.
Um, Tamta is saying, is egg donor available or admitted for single mothers? And in which case the single mother would have to use an egg donor and a sperm donor. So can single mothers bring their own donor sperm to your clinic? So can they make
No,
their own selection? Okay.
actually, it is not. I mean, of course, a single woman every woman can have a treatment with egg donation. Single, married, divorced, what doesn't matter. But sadly, the law in Spain is if you don't have a partner, you cannot be the one who brings a donor because it's illegal. It has to be
Right.
assigned here.
Okay. So the egg donor and the sperm donor have to be sourced by you in Spain.
That's it. Yeah.
Perfect. Okay, lovely. Thank you. That's lovely. Someone asking whether you have Danish egg donors, but I think we've probably covered that one already. And then we have Carol asking, you mentioned donors' blood group should be the same as the recipient. Could you
Not the
explain why that?
Not
Oh,
necessarily the same, but the same or compatible. This is like because if it is not compatible, there will be a rejection. It's not going to be accepted. Yeah, it's like when you make a blood transfusion. Yeah, um, and AB plus, for example, can only receive from can give to everyone, but can only receive from her. So you have to see an hematologically how it is going to fit. You cannot just give a random blood group, you know.
yeah, yeah. Do you have to be careful then about rhesus negative, making sure you're not getting a?
Always the rhesus and
Yeah,
the blood group.
yeah,
Always.
yeah. Of
Oh,
course.
yeah.
Yeah, yeah. Of course. Okay, lovely. Thank you. Um, And Aid has asked, when do you go about the embryo transfer if the periods have ceased?
When do you go again? Sorry, I didn't understand.
So I think what they're saying is, if they're not having any periods at all, how would you manage going about an embryo transfer?
So if you don't have periods at all, I will do an ultrasound, okay? If your endometrium is thin, we can start anytime, okay? Because this is what we want. We want to make it grow. So if it is thin, perfect. We're ready to start. If it is thick, because I don't know if it is irregular or didn't come in a long time, what we need to do is to provoke your period. This is easy. Once you have it, you get rid of your endometrium and it's again thin, then we can start.
Yeah, perfect. That's lovely. So it doesn't actually matter where or when. You can actually use drug protocols to manage that, and they don't need to worry about
That's
it.
it. Yeah, of course. Every woman with or without side periods can have treatment, of course.
So Mark has come back saying, actually, what the question is, can the egg donor be selected by nationality?
No.
No.
You don't. We didn't select within all the tests which they need to pass. If they pass all these tests, they can be selected. Yeah, we select them according that they fulfill all the tests. But then the patients are not allowed to choose the nationality or any other factors. It's anonymous. It's assigned, like I said, according to physical characteristics.
Yeah, perfect. That's lovely. Now, the next one is a slightly longer question. So I'm just going to display it on the screen and then just read it out. So here we go. This is from Jura. Hello, I'm 42. I'm interested in donor eggs. With donor egg cycles, how can a natural or modified natural frozen embryo transfer be planned without having to do multiple scans to check for follicle growth? Is Clear Blue ovulation kit not accurate enough or reliable enough to detect ovulation and plan for a natural or modified FET? If the LH surge is detected in a Clear Blue test, would Ovitrel injection still be needed for a modified natural frozen embryo transfer?
Yeah.
I'd like to avoid medicated embryo transfers with donor eggs.
Okay, great. I'm sorry, but the thing is, if it would be totally natural with Ovitrel, it would be a completely natural cycle, okay? And natural modified embryo transfer means always we have to monitor the follicular growth and we have to give the Ovitrel injection. There is no way to come around it.
Wonderful. That's a really succinct answer to quite a long question, I think, but that states very clearly.
Yeah.
And then we have, let me just bear with me while I just display the next one. Again, this is Belinda. If you know you are DQ alpha match with your husband and you have LIT treatment, but still no success with transfers, but later decide to do DE, would it be necessary to still do LIT as well as, I'm not quite sure what the next one
I
is.
don't really understand the abbreviations.
No, me neither. So please, Belinda, if you could just expand on that and put it in the chat, we'll come back to that one for you. I think, yeah, that would be really helpful. We've got lots. I'm doing my best to get through all of these. So you're doing amazingly, Beatrice.
Thank you, so you are.
Whizzing through all of these, amazing. So Audrey is saying, could an embryo that is employed after the PGTA test be also structurally or energetically abnormal? So I mean, chromosomally okay, but structurally not okay. So we're talking about euploid and euploid.
We check according to the chromosomes.
Okay.
So how is the embryo chromosomically?
Yeah. Okay. Okay.
Okay.
So
usually, if we need to check specific genes, it will be PGTA SR, not the PGTA. Yeah.
And as part of that,
if we need to check the embryo for a specific mutation, for example, because the mother or the father have it, then we can go to do PGTA SR. Yeah, but in general, the PGTA we do is always to check the embryo chromosomically.
Okay, that's perfect. That's perfect. Okay, we have somebody. Let me just go to this one. This is another someone, Mary, who's asking, is there hope for somebody who is in menopause. She's 47, and she went into early menopause. She has had an ultrasound scan. Everything looks normal, but she has a 2-centimeter fibroid and an absence of periods, and she is looking at both donor egg and sperm.
Okay, yes, of course she has a chance, because like I say, we take the eggs of a younger women, so it's perfectly okay with her uterus. What is interesting is to know about this fibroid, because the fibroids may difficult the implantation if the fibroid is in the uterine cavity, okay? But the fibroids may sit at different points in the uterus, okay? If we have the uterus and the uterus inside is the cavity and the myoma, the fibroid is here, we need to remove it because it does not leave place for a proper implantation and growth. But if it is on the walls or outside, it's okay. You can conceive perfectly with it. Myoma only needs to be removed if it takes uterine cavity or deforms the uterine cavity from outside, okay? But myoma is a benign muscular tumor, just that the tumor of the uterine wall, the muscle of the uterine wall got thicker at some points, and then that it is basically hypertrophied muscle, okay? This is not dangerous. Just in case you have symptoms or it grows too fast, or if it involves the uterine cavity, then it is suggested to remove it. Then you should please, in the first case, check the story of this fibroid. Where is it? Has been grown a lot, and so on. And then we can move forward. But it is no problem. The fibroids is something pretty common, around 40% in fertile women. And this is a case which is often, okay? And we removed the fibroids, and afterwards there was pregnancy with no problem.
Perfect. Thank you so much, Mary. I hope that's helpful. It sounds as though we just need a little bit more information about your fibroid. The others are fairly short. So could a baby have a type O blood group from biological parents with a type A blood group?
I should ask the hematologist on this part. I'm not so familiar with blood groups and so on. Just have to see if it's compatible. Okay, but the hematologist taking care of this part.
Yeah, I think that's probably a separate issue. So that's lovely. Thank you. And then at the mock cycle, this Bodron, would you need to use immunosuppressed treatment if this is in your protocol? And if the embryos are euploids?
Immunosuppressed treatments for a mock cycle?
Yeah.
No.
And if the embryos... Sorry, Beatrice, I interrupted you.
No, it's fine. Don't worry. We just need to make the uterine lining grow, and we do that with estrogen.
Okay, perfect. If the embryos are euploids, would it matter anymore about the classification quality? I'm not quite
I know what she means.
Yeah. Do you? Okay.
Yeah, she means because there are two ways to characterize him. The one characteristic is morphologically, and we have A, B, C, D. So A will always be the best classification, D the worst. Yeah. And I guess she means if it is euploid, does it matter anymore? Of course, we always have been following this morphologically, so it has something to do, but I have also seen euploid embryos class C implanting and euploid embryos class A not implanting. Okay, but we of course take it into account.
Yeah. Wonderful. That's wonderful. Now Belinda has come back with a little bit more information, so I'm just going to display this one, so we can read it.
Immunization there.
So is lymphocyte immunization therapy for recurrent implantation failure on this. So my husband's blood is taken and the white blood cells are injected back into me to help prevent my body showing a heightened immune response when I next transfer.
Yes. if we still need to use this type of therapy if I decide to use donor X. Yes. Yes,
Okay.
yes, I would still do it because at the end it's your uterus. Yeah.
Okay. That's it. Yeah, that's a short answer to quite a complicated but question, but absolutely,
There's
that's
no question.
perfect.
Yeah.
Yeah. And then the final question is Bodrum coming back. If you, I'm not quite sure what this is saying. If you don't, the partner has an abnormal gene, but even if the embryo is euploid, could it also be abnormal? So if, I'm guessing if it's euploid and it looks
The thing is,
normal,
if
could
the
it?
part,
Yeah.
sorry, go on, Barbara. Go.
So could there still be some mutations? Could it still be abnormal? I think that's.
If the So if the father or the mother have a specific genetic mutation, and we know it from the beginning on, we will not only do the chromosomic testing of the embryo, but also this specific mutation to see if it has it. One thing is the chromosome, and within the chromosome are billions of genes, and we would go check specifically for this one.
Okay.
I know if this answers the question.
Yeah, I hope so. I hope it has. Oh, I'm so sorry. My telephone is deciding to ring. My office phone. Apologies, everyone. Well, I think we've done amazingly and got to the end of all of the questions.
We got all the
So
questions?
we've answered all of them. So amazing. Well done. Well
Perfect.
done. Oh, that was fantastic.
Well, this was lovely, Barbara. Thank you so much for having
Oh,
me.
well, I just want to say on behalf of my IVF answers and the European Fertility Society, and also me, it's been such an interesting
Thank you
event,
so
and
much.
some amazing questions. So thank you everybody for your questions, but thank you so much for being with us and
It's a
answering.
pleasure, and we can do it again anytime. I hope it was
Wonderful.
helpful.
I think you've answered so many questions for people. So I will say thank you very much indeed on behalf of everybody. It's been
If you
such
get
a
some
pleasure.
more, you can forward them to me via email, okay?
Okay, we will do that. Yes, I think that, if there's some more that come through, then I know that
Yeah, you
Carolyn will do
have
that for you. Yeah, wonderful.
Okay.
Okay, have a lovely evening, everybody, and thank
Have
you
a
for
nice
being with
evening,
us.
everyone. It was a pleasure.
Take care.
Thank you so much, Barbara.
Okay, thank you so much, Beatrice. Take
Bye.
care. Bye
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 bye.
now. Bye bye.